All right, it looks like the entries into the seminar have slowed down. It's my very great pleasure to introduce Dr. Elisha Frye. Dr. Frye is a graduate of the Cornell College of Veterinary Medicine. Dr. Frye is a very experienced large animal and mixed animal practitioner with a long time in rural upstate New York. We're very lucky now to have her here in the Animal Health Diagnostic Center as one of our great veterinary support service staff, acting as a liaison between the laboratory diagnostic side, our veterinarian, and our clients. We're happy to have her here to speak to us about gastrointestinal parasites. And without any further ado, I'll hand it over to Dr. Frye.
Thank you, Dr. Donnelly. As you said, my name is Dr. Elisha Frye. I work at the diagnostic lab at Cornell, which is also the New York State Veterinary Diagnostic Lab. And today I'm going to talk about equine gastrointestinal parasites. So first, I'm going to review the common equine gastrointestinal parasites, and then I'm going to talk about fecal flotation as a tool. Then I'll review the available dewormers in the US, and then I'm going to talk about the fecal egg reduction test. And if you haven't heard of that, it's a very important testing strategy that is going to help us combat dewormer resistance in our horse population. At the end, I'll discuss some deworming protocols that you can consider for managing your horse or your herd. This is a photo of my friend, Dr. Kelly Nickelbein, who's on the Zoom, and I at a Halloween fun run. She is riding my Tennessee Walker Zeke, and I'm riding my standardbred Carter, and we're dressed as Mario and Luigi. I have to give Dr. Nickelbein credit for the costumes, but I thought I would start with this because, yay, parasites! So a quick disclaimer. I'm not your veterinarian. I cannot give you individual animal treatment advice. So you need to work with your veterinarian to create a deworming protocol that fits your horse or your herd. Also, this presentation is basically full of photos of my horses, my kids, my friends' horses. So if you're getting bored, you can just look at the pretty pictures. This is a photo of my dad riding his Tennessee Walker. He's a retired veterinarian. And my daughter, Seneca, on my standardbred, and then my little guy, Sylvester, riding my old quarter horse, Mary. I relied heavily on the AAEP parasite control guidelines when I prepared this talk, and they're a really good reference that is available for anyone to read if they want to kind of delve into it a bit further. There are veterinary parasitologists in the world. Those are folks that after veterinary school decide to focus on parasites specifically. I am not one of them, but I know a few of them. In this photo, you'll see on the far right here, a gentleman named Dr. Dwight Bowman. He taught me veterinary parasitology when I was a student. For some reason, I thought like he was the only one. And then I was lucky enough to go to the International Veterinary Parasitology Conference this summer in India. And there are actually tons of these guys. So these are all veterinary parasitologists, except for me. And we did a fun run one day. And at the end of the run, we went down to the beach, and there were these horses tethered by stakes, and they were just hanging out eating this shrub that grows on the seaside shore there. And they actually looked very robust and healthy. So that was just kind of a fun little equine tidbit. Dr. Manny Lejeune is this guy with the giant red arrows that I have pointed out for you all. He is a veterinary parasitologist at the diagnostic lab, and he is a mentor of mine. And he can't be here tonight to support me. So if I say anything wrong, we're going to just blame Dr. Lejeune. So that's why I pointed him out for you. He did tour me around India after the conference. And so here we are eating some traditional Indian food at an Indian wedding off of banana leaves, which are used as the plates. Also drinking some chai tea and visiting a Hindu temple and some other sites in India. Okay, back to the horses. So I'm going to go through some equine parasite vocabulary now, and then later on when I bring these terms up, you'll know what I'm referring to. So a fecal float is a technique for adding horse manure to a special solution that will float the eggs up, and then you can count the eggs to see how many are in your horse's manure. The fecal egg reduction test is doing a fecal float after deworming to see if your dewormer was efficacious. So did my dewormer work? Parasite resistance is the loss of treatment efficacy of a dewormer that used to have efficacy against the same parasite species and stage in the same host animal at the same dosage. So resistance has a very specific kind of framework. So we have to apply it to the same animal and the same type of parasite and the same dose of the same drug. Refugia are the refugee parasites that escaped the dewormer. So if I have 10 horses and I deworm 8 of them, all of the parasites that are in the 2 horses I did not deworm are refugia. And then also all the parasites that are out in the horse pasture at that time are also refugia. So they were not exposed to the dewormer. The prepatent period is the time from ingesting infected larvae until we're shedding the eggs again in feces. And that is different from the egg reappearance period, or EPG, which is the time between the last deworming and the resumption of shedding. So we're going to talk about the egg reappearance period later on when we talk about the fecal egg reduction. So the old ways, starting in the 1960s when dewormers were available, have led to much resistance in our worm burden in the horses. So folks used to be worried about Strongylus vulgaris, which is the large strongyle or the large bloodworm. So when dewormers became available, people were using them very frequently, every 2 months, and that led to pretty widespread dewormer resistance in our small strongyles or cyathisomins, also tapeworms and parascaris or ascarids in foals. The major equine parasites in my mind are going to be discussed each one now in detail. We're going to start with the nematodes, which are the roundworms. And this is confusing because people call ascarids roundworms, but they are actually just one of the 3 roundworms I'm going to talk about today. So nematodes include small strongyles, large strongyles, or Strongylus vulgaris, and then ascarids. And in the horse, we worry about parascaris, which is a type of ascarid. This is an image of a larva under the microscope. And then down here, we have an intestine from a horse that is literally chock full of ascarids. And so you can see why folks call them roundworms, because they look round to the naked eye. So these are actually just one of the 3 types of roundworms we're going to talk about today. And then I'm going to mention tapeworms or Anoplocephala, and this is the picture of the inside of a horse's gut with adult tapeworms stuck to the inside. And then we'll go through a few others. So I hope no one's squeamish, because there are some pictures of horse intestines in this presentation. So small strongyles, sometimes called small redworms, are the major player when we're considering egg parasites in horses. This is a picture of some horse manure that some adult small strongyles came out with the manure. So I've actually never seen these in horse manure, but it can happen occasionally, and that's where the name came from. The larvae live in the intestine of the horse, and then the adults move to the colon, and that is where they stay. So the small strongyles don't migrate through the horse's body like some of the other parasites. They make eggs in the colon, the eggs are passed into the pasture, and then they larvate, and the life cycle continues. This is a picture of the life cycle of the small strongyle. So the eggs are passed in the horse manure. They fall onto the grass, and then they larvate through 3 stages, L1, L2, and L3. L3 is the infective stage, and the horse actually eats the larvae when they're grazing. So the larvae kind of climb up on the grass, and then the horse bites the grass and swallows them. The larvae then enter the horse's gastrointestinal tract, and that's kind of where the problems may occur. This passage from L1 to L3 can be as quick as 3 days if the temperature is right out in the pasture. But if it's really hot or really cold, then it can take months. So there can be a big variance in how long it takes for the larvae to become infective out in your pasture. Once the L3 larvae are in the horse, they go to the intestine, and then they can encysted in the wall of the horse's intestine. So this top picture shows an encysted larvae right here. This little circular guy is an encysted larvae in the mucosa or the lining of the horse's intestine. And up to 90% of them can encyst, and then they literally just wait there until spring. They can stay from 4 months to 2 years, depending on what's happening outside. And then sometimes they come out in very large numbers in the spring, and that is what we call cyathisominosis. So your horse can actually colic and get diarrhea and be quite ill if there's a very large number of encysted larvae that decide to wake up and come out at the same time. That doesn't happen that commonly, though, so that's not something we need to overly worry about. It's just something to be aware of. The fourth stage larvae become fifth stage larvae, and then the adults go to the colon, and then they pass their eggs in the feces, and the life cycle is complete. So this can be as short as 5 to 6 weeks. It can also be much longer depending on the environmental conditions. I've put a picture of the horse's gastrointestinal tract at the bottom, so you can see where the small intestines are, where the larvae live, versus the cecum and the large intestine, which is where the adults live. On the left, we have another image of the life cycle of the small strongyles. So the eggs are in the feces, and then they larvae through L1, L2, L3 in the pasture. The horse ingests them. The larval stage 3 is in the mucosa of the intestine, which is the inside of the intestine. And then they can encyst, or they can keep going on and developing into the fourth stage and the fifth stage, and then the adults again. On the right, there's some pictures of strongyle eggs under the microscope, and then a strongyle larva. This is a table that looks at the effect of temperature on the survival of the eggs and the larvae out in the pasture. So if it's really hot out, above 104 degrees, there's no development out in the pasture. But when we get to 77 to 91 degrees, these guys are pretty happy. This is when they can go through the larval stages in as little as 3 or 4 days. So this is their kind of sweet spot for hatching and larvating. But they're also okay when it's colder. When we get down to a freeze-thaw cycle, like we have had in our winter this year in New York, then that's going to kill the eggs. But kind of anywhere between freezing and over 104, they're able to survive. And here's Zeke again making an appearance. Large strongyles are the scary ones that can kill horses. So these have a similar life cycle. The horses ingest the larvae while they're grazing, but they have a much longer prepain period. It takes 6 to 7 months for the full life cycle to develop. And this has helped us to not get dewormer resistance because of this long prepain period. The bad part about large strongyles is that they leave the intestine and they go up the blood vessel. So you can see this image here. It's a little cartoon of what these guys do. So they swim up the artery, and then because they're swimming against blood flow, they can start to make a big clot or thrombus, and then that goes back down the artery, and it literally wedges itself in a little tiny blood vessel. But that blood vessel is very important because it's feeding the gut. If you don't have blood, you don't have oxygen, and you don't survive. So then we can get what's called an infarction, or a dead piece of intestine. This is just another kind of image of the horse's cecum and then colon. And this is the mesenteric artery, or the big blood vessel that's giving blood to this different parts of the colon. And so you can see where these little arteries branch and get really tiny. And if worms and clotted blood stick themselves there, we're going to have a problem. On the left is an image of a horse that died from Strongylus vulgaris. So this is the lumen of the mesenteric artery, and it's literally chock full of the larvae. You can physically see them with your naked eye. This image on the right is a horse that's in surgery. So the surgeons are wearing sterile gloves. There's a sterile plastic drape, and all we see is the horse's intestine. But this is an infarct, or a dead chunk of intestine, because a Strongylus vulgaris cut off the blood supply. And then when you have this, the intestine is going to die. And if you don't remove this piece of the intestine, you have to euthanize the horse. So it's a very serious complication. And this is why folks were so worried and so happy when dewormers became available. I have 2 good news, bad news slides. This is the first one. We do not have any resistance in large strongyles, so that's good news, and that's due to the long prepain period. There is an increased risk of large strongyles if you only target deworm, meaning you only give some of the horses dewormer, and some of them never receive a dewormer. That has become a little bit prevalent in Europe because they are using a targeted dewormer approach. And the problem is when we look under the microscope, we cannot tell large strongyle eggs versus small strongyle eggs. They all look like strongyles. Luckily, these are not an issue in the US, but it's important that we keep it that way. Next, I'm going to talk about ascarids. As I mentioned, they're called roundworms, but they're just one of a few different roundworms. The one ascarid we worry about in horses is Parascaris equorum, and that affects foals because once they reach about 8 to 12 months of age, they have immunity against Parascaris and they can get rid of them on their own. So this is a picture of my daughter on the left with a baby foal at the barn where she takes riding lessons. So this was last summer with this cute little Appaloosa foal. It starts out with a similar cycle to the strongyles. The eggs are in the feces. The foal comes along and eats the eggs, which have the embryonated larva. But then the larvae leave the small intestine. They go to the liver. They hitch a ride in the blood vessels. They go to the lungs. They go from the lungs to the windpipe or the trachea. And then the foal coughs them up and swallows them again, and they go back into the intestine. So it's kind of a very unique but not so pleasant life cycle that the ascarids take inside the foal. We worry about impaction colics in foals because these roundworms can fill up the inside of the intestine. And this is that same image again of the impacted intestine. You can use a power pack to treat foals for Parascaris. You've probably heard of that. The active ingredient is fenbendazole. There is not resistance to fenbendazole in ascarids, which is good news, but there is resistance to ivermectin and moxidectin. Interestingly, small strongyles are the reverse. They have lots of resistance to fenbendazole, but not resistance to ivermectin and moxidectin. It's also good to use fenbendazole for ascarids because if you use a different product, you can paralyze the worms, and that can be more of a risk for impaction colic. But the way that fenbendazole kills the worms decreases the risk for an impaction colic. So it's kind of two reasons that we need to give our foals fenbendazole. Tapeworms are also called cestodes. Anaplocephala perfoliata is the tapeworm that affects the horse. High numbers of them can cause colic. They have an intermediate host, so they're different than the other parasites. The eggs are passed in the horse manure, and then a mite, pictured here, comes along and eats the eggs. The eggs develop into larvae inside of the mite instead of inside of the horse. Then the horse eats the mite while it's grazing, and then the larvae can attach to the cecum in the horse. So on the right, we have a picture of a tapeworm egg under the microscope. Tapeworms, we should consider deworming annually for them. They have a prepaying period of 6 to 10 weeks. They can be in the mite for 2 to 4 months, and they can be shed intermittently in packets. So the count does not matter for Anaplocephala. If we see tapeworms, we need to treat for them. This is a picture of the inside of the horse's cecum, and it's just chock full of tapeworms to the point where you would realize that the horse is going to have trouble absorbing nutrients because there's no place for it to do it because there's so many tapeworms. These guys can get up to 80 millimeters, which is 3 inches, and I do have a jar of them that I wanted to show you. So this is literally a jar of tapeworms that was taken from a horse that died, and you can just kind of appreciate how large they are. You don't reliably find them in a fecal float, so that's another thing to keep in mind. And the product that we use to treat them is called praziquantel. I did want to show my jar of ascarids as well. I forgot to show it in the last slide. So this is a jar of ascarids or Parascaris. So you can see how big these guys are just by the naked eye. My colleague, Dr. Goodrich, said, don't forget the donkeys. So this slide is dedicated to her. This is her with her guy Ringo, and evidently he's like a dog. She can just sit in the pasture and he'll come over and put his head in her lap. And she keeps telling me to get a donkey, and that does look kind of fun. Look, donkeys can get lungworm. They're called dictyocollis, and they don't cause disease in donkeys. But horses that live with donkeys can get sick from them and have coughing and ill thrift. So you have to do a fecal float in the donkeys to diagnose the dictyocollis because the horses are a dead end and they don't shed the eggs in their manure. The other thing to remember about donkeys is that they do not develop immunity when they're young to Parascaris like horses, so we can have adult donkeys that are affected by ascarids. Pinworms, called Oxyurus equi, can cause itching around the rectum because that's where they lay their eggs. So the horse will rub her skin and hind end on the stall door or the walls and maybe, rub off the fur and have an unkempt looking tail. You can do the Scotch tape test to look for the eggs. So there's a veterinarian applying Scotch tape to the horse's rectum to pick up those eggs and then look under the microscope to make a diagnosis. You can treat pinworms with 2 classes of dewormers that I'll get into later, but macrocyclic lactones, which includes ivermectin and moxidectin, or benzimidazoles, which include fenbendazole or Panacur. And this is my girl Mary looking at that horse's tush saying, I don't want to have those. Bots, I'm sure you've all seen bots on your horse's lower limbs in the summer. These are the bot fly eggs. And so basically your horse grooms them off, swallows them into the stomach, and then they make these giant bots that make almost these crater-like lesions in the horse's stomach. These are usually not that much of a concern. Obviously, if you get this many in your stomach, you could have some absorption issues. I also have a bark bot larvae for you. I know it's probably not that easy to see, but you can appreciate how big these guys are also. We diagnose these parasites by doing fecal flotation. So we need 10 grams of feces, which is basically 1 fecal ball. If a horse has bad diarrhea, that might be an excuse for not submitting a whole fecal ball, but otherwise you can get a whole fecal ball from your horse. If you have a sheep or a goat, they run away from you while they're running, they defecate, and by the time you catch them, there's no more feces left. We don't have that problem with our horses, so we should always make sure we have enough manure to do a proper fecal float. Feces are okay at refrigeration temperature for up to 7 days for a fecal float. If you wait past that, the eggs will actually larvate, and then you won't have an accurate count. So you've got to get that fecal sample to your veterinarian so they can either perform the fecal float themselves or send it to a diagnostic lab. And you have to keep in mind that shipping component if you're sending it to a lab, and make sure you're within 7 days. This is a picture of a bunch of fecals sitting in cups at our diagnostic lab after they've had the float performed, just in case anything needs to be repeated. There are a couple different techniques for counting eggs. We use the modified Wisconsin double centrifugation technique, which is quite a mouthful, but basically we spin them twice. And we use sugar solution and zinc sulfate solution. So 2 different solutions spun twice. This is highly sensitive. We can detect them down to 1 egg per gram. There's another technique called the modified McMaster. And this is a picture of that counting tool. And I also have one here that I'm going to just show in the camera. So basically, you don't centrifuge with this technique. You count the numbers in the grids, and then you have to do some multiplication, and you get your count. But it's not as accurate as the modified Wisconsin because of the multiplication. There's also a newer technique called the mini FlowTac, and I have one of them here just to show you. This is also no centrifugation needed, and it has a counting chamber that you can use a couple times before you have to discard it. So we don't offer that type of flotation at the diagnostic lab, but you may hear about it. The big picture is choose one technique and stick with it. Don't bounce around between types of flotation, because then it's going to be hard to interpret your numbers. I'm going to show you some videos now of Holly White, who is the parasitology lab manager, prepping a horse fecal sample for flotation. So I'm just going to play these videos, and then at the end we'll go to the next slide.
The first step that we do is we're going to weigh out 10 grams worth of fecal sample. So I'm going to take my horse fecal sample with my question number. I'm doing a quick check just to make sure that there's no pinworms, worms, or any other parasites right on the top. Mix it up, and I'm going to weigh out 10 grams worth of feces. We do 10 grams plus or minus 0.05, so that it's really accurate. Water. Okay, so I'm mixing it with 150 mils of water so that we're making every 1 gram of feces is 15 mils of water. So I'm going to mix it up. Kind of break it up just to get everything out of there so it doesn't leave anything behind. I'm stirring really well just to make sure that everything's completely mixed up and homogeneous. Okay. I'm going to pour in one smooth motion. to make sure that I get everything out of the cup. Swish my water, and I get all the goodness out. And then I'm going to pour my solution in between two tubes. We always use two tubes. We're going to label one with a zinc, and one is going to be for our sugar. So every sample will have two tubes that hold 15 mils of water. And we go back and forth between the two, filling them up. When I spin this down, this is going to represent 1 gram of feces, because 1 gram of feces for 15 mils of water.
I just thought that if I was doing this, I probably would have spilled horse manure all over the counter at least twice by now.
The first step that we do.
Okay, next slide.
And spin.
So at this point, she's going to centrifuge those 2 tubes for 10 minutes.
When it comes out of the centrifuge, you notice that it's pelleted down like this, and I'm going to pour it off into my waste container, just like you would your analysis. The pellet stays nice and firm below. No, my fecal. So this is my sugar solution tube. So I'm going to fill it up with my sugar solution. We use a 1.33 sugar solution, which is basically just sugar and water stirred up in mix. I'm going to fill it up to just below the label, mix it all up, break that pellet up. And what I'm going to do, I'm going to do it outside of the centrifuge. See it? I'm going to fill this up all the way to the top, and I'm going to make a very slight positive meniscus. And then what I'm going to do is put my cover slip right on the top of that. That's going to balance. And then I'm going to do the same thing for my zinc. The zinc that we use is a 1.18 zinc sulfate solution. Same thing. And then form that slight positive meniscus. Cover slip on. So if you have a glass tube and a glass cover slip, it will form a tight seal, and it will actually stay right on.
So now we'll centrifuge our sample again. So that's the double centrifugation, 2 spin cycles.
Off, and get down on my slide. And do the same thing. I'm going to use both my sugar and my zinc. And we're going to go through and look at all the parasites that are in it. And we actually go through and count. This is in theory 1 gram for our sugar and 1 gram for our zinc.
So that's the preparation for analyzing under the microscope.
So this is my sugar.
Sorry. And then this is the result. So we look under the microscope at that cover slip with the floated up eggs, and we look at that under a 10x magnification, and then we have to count the entire thing for both the sugar and the zinc. And this is a picture of a bunch of strongyle eggs under the microscope. We pulled some data looking at the number of equine fecal floats that were done from 2019 to 2023. So over a 4-year period, we did 15,085 horse fecal floats, which is a pretty good number. You know, we're getting a lot of samples from the Northeast, but also from across the country. Of those 15,000, 6,407 were negative or no parasites detected, and 8,678 of them had parasites detected. So just over half of them were positive. Then I broke it down by type of parasite, and you can see that the strongyles are by far the winner with 8,774. And you might say to yourself, that's more than the total number. How can that be? That makes no sense. And you would be correct. Sometimes the eggs larvate, like I mentioned before, and when the technician looks at the fecal sample under the microscope, if they see strongyle larvae, they count that as its own entry, and they count the strongyle eggs. So some horses will have 2 counts in this tally. So this number is a bit overinflated. 58.2% of the total fecal samples, and then 101% of just the positives. Obviously, you can't have 101%, so we have to realize that some horses were entered twice. I think big picture, that's not that important though, because the rest of the parasites are so much less. So Anoplocephala tapeworms were number 2 with 404 positive fecal samples, which represents 4.7% of all of the positives. Parascaris, which is our foal worm, was 229, representing 2.6% of the total positives. Oxyuris, which is the pinworm, was 45, which was 0.5%, and then 6 fecals had Dictyocollis. So the rest of the players are very minor compared to the small strongyles. There's a mantra that the few horses are going to shed the most strongyles following the 80-20 rule, meaning 80% of the parasites come from 20% of the horses. The heavy shedders will always be heavy shedders, and they're pretty much always going to be healthy. The AAEP has made this classification list for us, so we can categorize horses as low, moderate, or heavy shedders based on how many eggs per gram we count in their fecal. So 0 to 200 is low, 200 to 500 is moderate, and over 500 is a heavy shedder. So we only deworm the heavy shedders based on these AAEP guidelines. This is a chart I have made of the available dewormers in the US. It's kind of basic, but I think it's good because big charts, you know, your mind starts to glaze over. So we have the enthelminthic class, which is the class of dewormer, and then we have the drug name, which is the active ingredient, and then we have the brand name, and then we have the parasite that they will target. So benzimidazoles are a class of dewormer. Fenbendazole is the horse dewormer, and the brand name is Panicure. So this is a picture of a Panicure tube. You can see in parentheses it says fenbendazole, and that's a benzimidazole. So these are labeled for strongyles and Parascaris. As I mentioned before, we have a lot of resistance in strongyles to fenbendazole. This class is a mouthful to say, so I'm going to give it a whirl. Tetrahydropyrimidines, and the drug name is Pyrantel, and that's probably one everyone's heard of. So here's a picture of Pyrantel. The brand name is Strongid, and those are also labeled to kill strongyles and Parascaris, so we have resistance to strongyles in this group as well. Macrocyclic lactones include ivermectin and moxidectin. So those are in the same class. The ectin at the end of the word, I think, gives you a hint that they're kind of similar. Ivermectin is generic, and it also goes by zymectrin and duramectin. And then moxidectin, the brand name is Quest. So these drugs treat strongyles and Parascaris, but we have resistance to Parascaris. And moxidectin is labeled to get the encysted stage of the L3 larvae in the gut wall. So that can be really important if we have a cyathistominosis case. Isoquinolines are an enthelminthic class that include praziquantel, which is the drug for tapeworms. I kind of think of praziquantel as like the evil stepchild because it just gets stuck in with the other dewormers. So it's the plus in Quest Plus, it's the gold in Zymectrin Gold. So these are just moxidectin plus praziquantel, ivermectin plus praziquantel, and that drug praziquantel just kills tapeworms. This is a bigger chart that I found on the Zoetis website. It's nice if you want a little bit more detail about the product. So across the top, they have the brand name and then the active ingredient and then what parasites they target. So this is just kind of here in case someone wants to look more in depth at the individual available products. A quick comment on dosing. Use a weight tape. So my quarter horse mare is this little thing, and she weighs 1,050 pounds. And my standardbred is a tall, lanky guy, and he's between 850 and 900 on the weight tape. So it's really important that you weight tape because you want to err on the side of overdosing with dewormers rather than underdosing. A little bit of an extra dewormer is not going to hurt your horse. But if you don't give it enough, you might encourage parasite resistance. Now I'm going to read that definition of dewormer resistance again, and I'm going to add in a little bit more information so we kind of know what this is. Resistance is the ability of worms in a population to survive treatments that are generally effective. The rate of development of resistance is determined by selection pressure and the extent to which worms surviving treatment pass their genes onto the next generation. With continued selection and reproduction of resistant worms, the frequency of resistance genes in the local worm population increases to the point where treatment fails. So these worms are passing their genes on to the next generation of baby worms, and that's how we perpetuate resistance. Once resistance is present, the population of resistant parasites do not appear to revert to susceptibility. So the aims of resistance control are to prevent the first steps in the development of resistance and then delay the accumulation of resistance genes. This is a graphic of the process of parasite resistance. So the blue worms are not resistant, they're a refugia, and the red worms are our resistant worms. So if we have just two bad guys and a bunch of good guys, and then we give a dewormer, we kill off the good guys, and the bad guys reproduce. So now we're at like a 50-50 ratio of resistant and susceptible worms. And then we deworm again, we kill off more of the susceptible worms, and now we have mostly resistant worms and very few susceptible worms. So we can keep giving that product, we can increase the dose of that product, but we're not going to kill those parasites. My second good news, bad news slide. So this is kind of depressing, right, to think about the parasite resistance we have. But the good news is that the Power Pack fenbendazole still kills Parascaris in the fold. All of our dewormers still kill large strongyles, Strongylus vulgaris, the one that migrates through the vessels, and moxidectin kills the encysted strongyle stage. The bad news is that small strongyles are resistant to fenbendazole and pyrantel. Ivermectin and moxidectin still kill strongyles, but the egg reappearance window is lessening, which might be a hint that we're getting resistant. So the egg reappearance window, the time from deworming until your horse is shedding eggs again, used to be 9 to 12 weeks for ivermectin and 16 to 22 weeks for moxidectin, and now there have been reports as low as 4 to 5 weeks for both products. This is a picture of another veterinary friend, Barbara. I convinced her to go riding with me on Sunday morning, and it was kind of a cloudy day when we started, and then it literally hailed on us. So she gets the Good Sport Award for riding in the hail with me on Sunday morning. This is a table put out by the AEP that reiterates that resistance pattern that's kind of inverse. So the benzimidazoles, Panacur, we know there's lots of resistance with the small strongyles or cyathistomins, and then it still works against the Parascaris or the ascarid. And the opposite is true for the macrocyclic lactones like ivermectin and moxidectin. So we have still working dewormers against the small strongyles in this class, but then widespread resistance in the ascarid. The large strongyles, luckily, are still susceptible to all three classes. Now I'm going to talk about the fecal egg reduction test, which is going to help us all mitigate this problem. This is available at the diagnostic lab, and this is a way of asking, did my dewormer work? So what you do is you collect a manure sample a while after your last deworming, so maybe in the spring. You send it to the diagnostic lab where we do a fecal float. You give your dewormer, you write down what product it was, and then 14 days after your dewormer, you do another fecal float. Ideally, you would do 6 animals in the herd. If you don't have 6, then you should do everybody. The 6 animals can give you a good idea of the overall resistance in the herd. At our lab, the second fecal, if you follow this 14-day protocol, is massively discounted. I just want to comment that fecal samples have to come from your veterinarian to the diagnostic lab. We cannot accept fecals from owners. They have to come from a vet because we don't have a relationship with you as a horse owner. Your veterinarian does. So we can discuss the results with your vet, and then it's up to you and your vet to decide how you implement them. This is the formula for the fecal egg reduction test. And usually when I see a formula, like my eyes glaze over and I can't think, and I'm like, it's just too much math. But this one's really not that hard. So we're going to go through a really easy example together. So the formula is eggs per gram pre-treatment, so on day 0, minus egg per gram post-treatment, divided by eggs per gram pre-treatment times 100. So let's do an example together. If you have 700 eggs per gram pre-treatment and you give Panacur, and then 14 days later you submit another fecal and you have 100 eggs per gram, you just plug these two numbers into the equation. So 700 minus 100 is 600, divided by 700 is 0.857. You multiply that by 100 and your reduction is 85.7%. So just take a minute and think to yourself if you think this is a good outcome. Like, are you happy with this? Do you think that the fenbendazole worked against your small strongyle population? Okay, so here's the answer. The AAEP luckily has guidelines for interpreting the fecal egg reduction test for small strongyles and our 3 dewormer classes. You cannot extrapolate this information to your dog, sheep and goats, tapeworms. It only applies to horses, these 3 dewormer classes, and small strongyles. But we're lucky we have this because we don't have this for the other species and the other types of worms. So benzimidazole, that's the class that fenbendazole is in. If we didn't have resistance in the world, we'd have 99% efficacy. But in the real world, we are considering it susceptible if we're above 95%. We're suspecting resistance if we fall between 90 and 95% fecal egg reduction, and if we're less than 90%, we're resistant. So this horse was 85.7%, and that means that we have resistance to fenbendazole in small strongyles in this example. I'm going to move to a real example of a herd that struggled with parasite resistance. So this was a research herd at Cornell. In 2017, they went through and did a fecal egg count on everybody in February, April, July, and September. So winter, spring, summer, and fall, basically. And then whatever the highest count was, that horse got put into the category based on the highest count. Oh, and I have to mention that there were some donkeys in there. So these tan boxes, Flapjack, Blackjack, Siggy, Samantha, Chanel, and Melissa are all donkeys. So this first horse, Rykon, he had a 980 fecal egg count in September, so he goes in the heavy category. Sansa had a 870 in September, so she goes in the heavy category. But interestingly, in April, she was 0. So if you only tested her once, you would be like, oh, she doesn't have any parasites. But it could just be the wrong time of the year for that individual animal. If you come down, there's some other interesting numbers. Twilight had 1 in February and then 0 the rest of the time. So this horse is just a very low shedder for small strongyle. And then we totaled them at the bottom. So there were 40% of the animals that fell in the low category, 7.5% in the moderate, and then 53% in the heavy. So this herd did not follow the 80-20 rule. It broke the rules. We know that we're supposed to have about 20% of the animals in the heavy, but for whatever reason, this herd has 53% heavy shedders. So that's a lot of heavy shedders. They gave the entire herd moxidectin and then did a second fecal egg count, performing the fecal egg reduction test. And literally everybody was 0, except for Symphony, who had 4. And then this horse here, Santana, who had 1 egg per gram. So that resulted in 100% efficacy for moxidectin, except for this scenario where it was 99.76%. So also still very efficacious. So we know that we have moxidectin susceptible parasites in this herd. In February of 2018, we redid our fecal egg count. So lots of horses have repopulated their gut with parasites, which is not unexpected. Then they gave fenbendazole, and they did a second fecal float to look for the fecal egg reduction, and there was literally none. This horse actually more than doubled its fecal egg count. So it went from 528 to 1240 after receiving fenbendazole. The worm said, we don't care about you. We're actually going to even have more. So this product totally failed. There is widespread resistance in this herd to fenbendazole. The only animals that were affected went from 1900 to 1050, and that's only a 45% reduction, which we now know is consistent with resistance. And then this horse went from 1100 to 750, which was a 32% reduction. So this herd decided to annually treat the whole herd with a dewormer that would broadly get bots, tapeworms, and large strongyles, and then target deworm the heavy shedders for small strongyles. They had historically been deworming very aggressively the whole herd, so they changed that and only focused on the heavy shedders. This is a real case of resistance number 2. A 3-year-old paint quarter horse gelding was bought from an auction and then given Strongyl, which we know is pyrantel, every 2 months for a year. The horse went to a new owner. The owner did a pre-treatment fecal float on July 26th of 2023, gave a dose of Strongyl, and then 14 days later, on August 9th, did a post-treatment fecal float. So the pre-treatment was 760 strongyl eggs, and the post-treatment was 351 strongyl eggs, which which resulted in a 53.8% reduction. So this horse is resistant to pyrantel. This is a snapshot of how our results look. So if you do a fecal egg reduction test, we're going to give you this information and then also the AAEP guidelines for interpreting resistance. Resistance case number 3, a 17-year-old paint mare with chronic diarrhea. Her pre-treatment fecal float was done on July 27th of 2023. She received a power pack, so she got 5 days of fenbendazole at a certain dose, 10 milligrams per kilogram. The last day of the Panicure power pack was on August 12th of 2023, and then 17 days later, we did the fecal egg reduction test. So they didn't strictly follow the 14 days, but it's okay. It's just 3 days extra. The chance that we are really repopulating the gut at that point is very low. But so the pre-treatment fecal egg count was 640, the post was 382, and that's only a 40.3% reduction. I think this is an important example because sometimes people want to think that more is better, like we give more fenbendazole, so it'll kill them. But that's not true. If there's dewormer resistance to fenbendazole, it doesn't matter how much you give. It's still not going to work. The final example is my horse, my personal horse. So I adopted an 8-year-old standardbred gelding retired racehorse in November of 2021. The adoption group dewormed him with moxidectin the day before I took him home, which was very nice of them. So kind of cleaned him out before coming to live with me. And then 4 months later, I waited a while, I did a second fecal float, and he had anaplecephala. Remember, our tapeworms. And that doesn't matter how many, it just matters that they're there. So it was only 2 eggs per gram, but I still needed to treat him for that. He only had 5 strondile eggs, so yay, buddy, pretty low number. Maybe it's not peak time for him to be shitting them, though. And then he had parascaris, 26 parascaris eggs per gram. And I kind of thought to myself, well, he is pretty immature and acts like a baby, so that makes sense that he would have the full parasite. So I had to worry about both of these, the anaplecephala and the parascaris. So I gave him Panicure because we know that that product will still work against parascaris. And then I gave him Zymectrin Gold because it has praziquantel and I wanted to treat those tapeworms. Here's some fun pictures of my kids at riding lessons over the summer. The takeaway, I think, from these examples is that in an ideal world, which I think most of you can actually do, is that you would do a fecal float on every horse 4 times a year initially for 1 year. Making sure you're doing it in the spring and in the fall when you're expecting large parasite burdens in your horse, depending on where you live. So I'm talking about this area, but if you're in a part of the country or the world where there's a hot season at a different part of the year, then you need to take that into account. Find out who's a heavy shedder, who's a moderate shedder, who's a light shedder. Do a fecal egg reduction test on the heavy shedders, and then target deworm just the heavy shedders based on the egg reappearance period. And only do that during the heavy shedder time, right? So if those guys are not shedding in the middle of winter, you don't need to deworm the heavy shedders in the middle of the winter. You only need to deworm them when they're going to be having high burdens inside and also out in the pasture. Continue a fecal egg reduction test on heavy shedders annually. And if you see resistance slowly creeping in, you should probably consult a veterinary parasitologist who may recommend that you shorten your egg reappearance window, meaning you give your dewormer that works more frequently. An important concept, though, is that all of the horses do need to be dewormed once or twice a year, regardless. We don't have large strongyles as an issue, but if we only target deworm certain horses, we might have reemergence of large strongyles. And they have that long pre-patent period of 6 to 7 months, so that's in our favor. So we can deworm everybody once or twice a year. This is a chart from a textbook. It's actually a European textbook, but I like the bottom row of it, and I wanted to show you all this. So this is horses that are over 5 years old, which I feel like is most people. They have, you know, a few pets. X is the time of treatment. X in parentheses is treatment only after positive monitoring results, and MO stands for monitoring. Our A's are for anaplecephala, or tapeworm. Our G is for gastrophilus, which is the bot. P is for parascaris, that's our ascarids, and then S is for small strongyles. I didn't actually mention strongyloides in this presentation, so we're going to kind of ignore them. So this chart is telling us that in May, all horses need to get a dewormer effective against strongyles. In August, They're recommending monitoring and treating only if you have strongyles and anaplocephala on the premises, because we don't always find the anaplocephala eggs. November, they're recommending deworming everybody again for strongyles, anaplocephala if on the farm, and spots. And then in February, monitoring and deworming who's positive. So this is not a perfect plan, but I really want to drive home that I'm not recommending that you never deworm some horses. Everybody does need to get dewormed once or twice a year, but the frequency needs to decrease so that we're only doing the heavy shedders when they're shedding heavily. This is a chart of the egg reappearance period. And remember, that's the time between deworming and then shedding eggs again. So just because you're shedding again doesn't mean you have resistance. It just means that they've gone through that whole life cycle and now they're shedding again. When the drugs were first on the market, we used to have these long ERPs. Bendazole was 6 weeks, Pyrantel was 5 to 6 weeks, ivermectin was 9 to 13 weeks, and moxidectin was 16 to 22 weeks. But now that window has shortened, and so we're down to 4 to 5 weeks for the top two products, 6 to 8 weeks for ivermectin, and then 10 to 12 weeks for moxidectin. This graphic is from a paper that just came out in 2023 titled Egg Reappearance Periods of Anthelmintics Against Equine Cyathosomes. And now you can decipher that. That means the period when the eggs are going to start again after giving a dewormer, effective against strongyles. And so this is where we used to be for ivermectin and moxidectin by time, but now there are reports of horses shedding eggs in their feces in as little as 5 weeks with both of these products. I do want to mention that deworming foals is different. We don't do fecal egg reduction tests on foals. So the AAEP guidelines recommends deworming foals 4 times in their first year of life. When they're 2 to 3 months old, we've got to hit them for the parascaris. We don't want to get lots of ascarids clogging up their gut. So we're going to use fenbendazole because we don't have resistance to that parasite. When they're 6 months old, we should do a fecal egg count to figure out, did they have strongyles or did they have parascaris? And then we're going to choose our dewormer based on that fecal egg count. When they're 9 months old, we should deworm them and include praziquantel so we can get tapers. And then when they're 12 months old, we're going to deworm them again. The goal should not be 0 parasites. And I think this quote's really nice. In traditional deworming programs, repeated treatment of low shedder horses every 2 to 3 months accomplishes little to improve their health, but it does promote drug resistance. So we have to start giving everybody dewormers, stop giving everyone dewormers every 2 months. The goal is to decrease the strongyle egg numbers in the environment, not to have 0. So in summary, a fecal float 4 times a year initially to establish who's a heavy, moderate, and light shedder. Deworm in the spring and the fall, because that's when the weather is favorable for large numbers of strongyle larvae in the pasture and large numbers of strongyle larvae in the gut of the horse. It also will have more refugia available out in the pasture. And then target deworm your heavy shedders seasonally, deworm for the egg reappearance period seasonally, do a fecal egg reduction test on the whole herd every 3 years to monitor, and then do a fecal egg reduction test on your heavy shedders annually. This is my reference slide, so things I relied on to make this presentation, and now I will take questions.
We have some questions here. I think a lot of them you answered during your talk, so that was a really efficient way to do this. This is a question that has come in on our Q&A there's probably not one good answer for, and I would hope that this hasn't really been documented, but what would you do if you had multiple resistance from amongst the parasite population? Or what are some things that we can look to?
Yeah, that would be a pickle that we might potentially all be in. I would probably continue to monitor who's a heavy shedder and who's a moderate shedder and who's a light shedder, because they're not all going to be heavy shedders. And then maybe if we can't reduce the number of eggs in the heavy shedders, at least we can monitor them health-wise and make sure that they're healthy, because some of them may very well be fine being heavy shedders and have a good immune system that's just living with all these parasites. I guess another comment is that another pickle that we're in is that there are no dewormers coming through the pike. Like there's nothing in the back burner, and kind of what we have on the market is currently what's available. So I don't think there's going to be something that's going to come in and save us all So we have to work with the classes that we have available.
I think that's a really good point to sort of, round us out on. Dr. Frye, can you remind us what's the best way to collect samples to submit to the lab?
Sure. So if you see your horse defecate and you can grab a fecal sample and put it in, there's urine cups that folks often use, or any kind of container. It doesn't have to be sterile because horse manure is not sterile. But you just want a fresh fecal sample that can be sent to the lab or to your vet clinic quickly, because if it sits too long, the eggs are going to larvate and then you're not going to have an accurate count. So don't get a fecal sample on Friday of Memorial Day weekend, right? Because then your fecal egg count's going to happen like Tuesday at the soonest. So that would be a bad time to collect a fecal sample. And also don't go out to the pasture and just grab a bunch of random fecal samples from different horses and composite them. We don't recommend composite fecal samples because you don't know who's a heavy shedder, right? So you're kind of thwarting this whole process if you just mix the fecal samples together at this point.
Perfect. And this is to kind of capture a couple of people's questions. But do you have any advice on sort of the environmental part of the management of horses for parasites?
Yeah, I was reading that back in the olden days in England, there used to be like boys who would go around and literally pick up the horse's manure every time it defecated. And this morning I was cleaning my horse run-in and my horse like went to poop and I literally caught it in a shovel and I was like, I am doing that for you right now. So there has been like vacuums made where you can clean the pasture. But I don't think they're like realistic for most management systems. And some folks don't put their horses out on pasture at all. So like in the dairy world where we have cows living inside, we don't have to worry about worms because they can't have that larva in the grass. So if you have one of those systems, you could also decrease it. Maybe if you had a horse that had resistance, you would actually be like, okay, you're going to live on a dry lot and we're going to pick up all your manure and maybe that'll eventually help because we can break the cycle that way. But I think for most horse owners in the US, that's a bit unrealistic.
Great. And I think just one last one to kind of round out that. I guess a lot of people probably board their horse. Do you have any advice when it's a multi-owner, multi-horse environment?
Yeah, that's hard. So in a perfect world, everyone in the barn would get together and say, hey, let's submit fecals on our horses, at the same time of the, 4 times a year and to see what we've got and make a big spreadsheet like we did for the research herd and see who's a low, moderate, and heavy shedder. It would be great if barn owners wanted to coordinate that. If you can't get everyone to do that, maybe at least like if your horse is turned out with some other horses, those pasture mates could do that together, or you could at least do your own horse, right? You could at least do a fecal float on your own horse or maybe 5 or 6 times a year. Fecal floats are actually not that expensive in the grand scheme of horse ownership. So I think this is something we can start employing a little bit more.
Fantastic. Well, we are at 7 o'clock. Everybody, if you have any further questions, then please feel free to write them in. Our speakers are normally happy to provide answers for these after the talk, and we compile those. That's it for this evening. Thank you to Dr. Frye. We will be back next month with our program, and next month's presentation will be mud management.